For some of our newer viewers, you may not know Joanne. Joanne has been a long-time patient, more than 20 years, and when her husband was with us, he was also a patient. Joanne is diabetic and she has some other health concerns, including lymphedema, which many people have noticed on the videos and we've talked about. There is actually on my channel a whole playlist dedicated to Joanne, so you can go back and look at some of her earlier videos. But this was the first time in 5 months I had seen her. Last time she was in a rehabilitation facility and was under investigation for COVID, which she ultimately didn't have. But right now she's back home and has some other caregivers that are coming to see her a few times a week. And she was nice enough to let me bring in the camera and videotape. I apologize that some of it is very dark. I figured it would be pretty intrusive to bring in our great big filming lamp. Please enjoy the video. Let me know if you have any questions. And Joanne really does read comments and she really appreciates everybody's good wishes. So what are you doing for your right foot?
This foot? The right foot?
The right foot, yeah.
Nothing. I mean, just like what they've been doing.
Do you mind being videographer?
Sure.
Okay.
So as close as you can get to see what's going on here.
Okay.
All right. So these are nice and soft because you guys just soaked them.
Yeah.
But when we get to the right foot, we're going to talk about what is being done for it.
Okay.
Because I haven't seen you in about 5 months.
That's the truth. I'm not denying that.
Right, and we need to kind of work together as a team to figure out what we're going to do about that, because it seems like the ball has just been dropped.
Yeah.
So this foot looks not too bad, just really long nails.
What's that lump on top there? Does that mean anything?
That's just,
Fat.
yeah, that's just part of the fat pad.
That's okay then.
Yeah, that one is fine.
And that, I had that bad big blister on there, boy, that healed.
Okay. It's just going to come right off. These are just so, they've stayed so wet, these nails.
Well, better than being hard.
Let's see, they just kind of peel right off.
There goes the nail.
Yeah.
I see.
This one doesn't, is there a nail on there?
Yeah, but it's not much.
Yeah, not much. And big one. And I'm just going to take off here whatever's not attached.
Okay.
So how long have you been home, Joanne?
I've been home now 2 months,
2 months?
around 2 months.
Okay. And you've got these wonderful nurses and therapists coming out.
Yeah.
How frequently?
3 times a week, Monday, Wednesday, and Friday, and then the athlete comes out twice a week.
Who comes out?
Bath aid.
Oh, okay. Now, am I getting in the way of your guys' routine, what you need to be doing?
No, I allotted extra time.
Yeah.
I don't know about.
Okay.
Yeah, I think.
All right, because I don't want to hold you up if you've got more places you have to be.
No, I told him about this as soon as I knew that you were coming.
You told them Dr. Nail Nipper was coming to do a new video?
Yeah.
She did.
Oh, you're funny. Well, I don't do house call, I don't take on
I
any
know.
new
you don't.
patients.
Yeah, I know that.
But for people I
I told
adore,
her
like
she had my
Joanne.
husband, oh God,
Yeah.
she's the best.
So is that all you do, is house calls, or do you work
No,
at
no,
a
no, no,
clinic?
I have a
No.
clinic.
Oh,
She's got
okay.
a clinic.
But for patients who have been long-time patients who can't get in anymore,
Sure.
I'll come out and see them. I don't see any corns or calluses or open wounds. Let me just get an emery board.
The green one, Makita, the green one, grab the green one.
This looks way better than it did last time, sorry. Okay. Let's just kind of move everything away here and we'll
A lot of stuff on. Yeah. But I know everything that goes on. I know it like a book. Makita, turn the kitchen light on.
Where is it?
Right on the corner of the wall. Thank you. Do you want to hand her the wastebasket?
Thank you.
See them pads go, one on top of one about.
See that, and then we got.
You just pull it. That goes over the two toes there.
Everything there.
Okay, let's go ahead and put the other foot up here too.
Want the other foot up?
Yeah, let's put both
Do you
feet up.
want me to soak it first or not? What do you think?
It's up to you, you guys. Well, I don't know what your
Yeah,
schedule is.
We usually,
What it's doing is using wound cleanser on it. You okay with that?
Yeah, that's
Okay.
perfect.
yeah, they have, first you take the washcloth and get the flesh off. You know what that's called, the flesh? They do that first. Get the flesh by the toes off.
Now,
No.
does this hurt at all?
No. Sometimes the toes go there.
Well, even that looks
Better.
90% better than it did when I saw you in rehab.
Well, I hope this will. I hope it's getting better.
Yeah, now are you sitting with your feet down most of the time or up?
A lot. Because my butt hurts.
Mm-hmm.
I got wounds on the butt, you know.
Are you getting up and moving around at all?
I can't move very much, you know. I go to the bathroom and I'll sit and I stand.
Like a dry towel? What were you
Yeah,
using?
there's a dry towel right there.
Oops, sorry. You want to put your foot up here? Is that?
Okay.
Hold on. Let me. So you're not going like across your body there.
It's gonna turn anyway, it turns. I can't help it.
Now, how many times a week is this all happening for you, Joanne?
3.
3 times a week they come out, soak it, wash it with the wound cleanser? Okay.
Wash it in water. Then you're gonna trim nails, right?
I'll trim the nails, yeah, and I just want to make sure that I'm not seeing any open sores or
Oh,
open
okay,
wounds.
yeah, that's fine.
You know,
Yeah.
okay. Are you guys good?
Yeah.
Okay, ready for me. Now, I'm wondering, because now, I mean, before your entire foot was red.
Yeah.
Now it's limited just to here and out. Has anybody done a fungal culture on this?
No.
Not that I saw recently.
Okay, is that something that I can order and you guys can do?
Yes.
Because I'm wondering, you know, you've been on an antibiotic for bacteria, and that's gotten you a certain point, and right now there's no open wounds except just some of the skin slough that's happening here. I'm wondering if maybe there's not a fungal infection that's causing this. So, do you guys have any other thoughts? Stuff you think would make a difference that we could order?
They use that fungal powder they were using.
Yeah, and that may be why it looks as good as it does compared to last
Yeah,
time, but
yeah.
right now what I'm seeing is just, it's still thick and red and
What
infected.
do
and
they do for a fungal infection? What do
there's
they-
other antibiotics that you can go on that are
Oh, okay.
specifically meant for fungus.
Oh, okay.
Okay. All right, so let's just make sure we're. And because this is very unusual looking, Joanne. You know, usually with something that's this red and swollen and soupy, there's an open source somewhere that we can point to and go, that's the source. But you don't have that, and you know, the skin is just kind of deteriorating on the toes, so.
Yeah.
So yeah, there's no open source, and it makes you wonder what's on the skin, right? Is that-
Exactly, that's what I'm thinking. So, you know, and nobody has fungal nails like this that also doesn't have like a low-grade chronic athlete's foot kind of infection. So I'm wondering if we've just got an overgrowth of fungus here that may be what's causing, you know, the redness and the drainage and. So, yeah, you just tell me where to send the order and we'll call it in, or I'll call it in, or I can write it here.
Yeah, I think if you just write it,
And then give
or
it
you know,
to-
you can even just give me a verbal.
Okay. So let's do a skin scraping culture for. Am I hurting you at all, Joanne?
No.
Skin scraping culture,
Yeah, right foot,
right foot.
right toes,
Yep.
for bacterial and fungal culture.
For bacterial and fungal culture. And I'm sorry, how do you spell your last name?
Oh, Sperling.
Sperling.
The only foot doctor around.
Oh, there's plenty of us.
Oh, yeah, there's plenty of doctors. There's good, and then there's not so good, and then there's bad. This is like therapists. I've had them all. I've had them all with interim, and this one tops it. I'm not saying it
I'm
because
just
she's
wondering
here.
if I
I
have a
do.
swab out in my car.
Are you making sure we're on camera? Okay, because, you know, her fans are gonna be
Sorry.
really unhappy
Still says recording.
if we're out of frame, though.
We're right, you're right.
She has fans, you
What's in the
know?
frame?
Okay. She's like Nora Desmond.
Now that, I'm gonna tell you a story.
Yes.
Between, let me see what tool that is.
This is your, next to the baby toe, yeah.
Okay. Between the third and the fourth,
Yes.
that hurts.
Does it itch at all?
No, but that was hurting for a long time.
Okay,
Now it's just off and on tingles and throbs.
okay. Well, you know, I'm thinking that the culture is most likely gonna come back positive for fungus, and then we can get you on an oral antifungal in addition to the powder.
But how do they do the oral fungus?
The oral, it's a
Yeah.
pill.
You just take a pill?
Well, you know, again, let's see what it grows, and then it depends on what you're already on. Yeah,
Okay.
but you take it like a pill, and it'll be stronger than the powder,
Okay.
because it'll make sure that,
It's going in your system.
right. And that may, you know, this is already so much better than it was last time I saw you,
Yeah.
but let's see if we can get it the, you know, the last 25%, so it looks like your other foot.
Yeah, right.
And I
Yeah,
think
we
that,
don't.
that to me feels like the one thing that nobody is tested for.
You're right.
And then if that comes back, you know, and then we can treat this and get the skin healed here, we'll get you back on that compression pump to get that lymphedema down.
Okay.
Now, what is it that's keeping you from being up and moving? Even just walking around the apartment. Are you laughing at me?
No.
Oh.
No, it's because my legs are bad and my feet is bad. It's too, you know, I have a hard time.
Right.
And with the shoes, that's another question.
Well, even
Look
if
at
we,
what I'm wearing. Just look at, that's all I can get in.
a surgical shoe?
Yeah, and
Okay.
it's, the things don't stay tied, I mean, don't stay, the Velcro is wearing out, it's really bad.
Well, that's easy enough to get you new ones. And if that's what you can fit on your foot, then that's what you need to wear. And especially because you said you've got some open sores now on your bum.
Oh, yeah.
So we need to get you up and moving a little bit more. Moving will help the swelling in your legs.
But the swelling is a lot better, you know, like,
It is. And I want to get you back on that compression pump because that, you know, it's not going to fix it, but if we can squish all the swelling out of your legs every day, it'll be way more comfortable.
I really got sick. They had 3 paramedics had to lift me off the toilet, and then they almost dropped me on the floor.
I'm sorry to hear that. I
103
don't think
temperature.
that has to do with using the pump. I think that was just coincidental. All right, so let's let these ladies get you all back wrapped up. Let me take this out.
You want to see how they do it? Ow.
Yeah,
Okay. There you go. Yeah, she doesn't told, not even all the therapists know how to do this told.
No, that's wonderful.
But she's good. It's better. Yeah, she does it like a piece of cake. Nurse was out Monday. Don't ask me to take that off. I'm not taking that off. I'm not taking that off. Jessica's got to do it.
that's an awesome wrap. It's a good wrap.
Yeah, thank you.
We'll come back and we'll see what's going on with the right foot. You're getting treated like a queen here, you know?
I know. You know what, Nikita says, You love every minute of it.
No, that I don't agree with, but
No. No, can I have like when the great grandkids come over, like comb my hair? Oh my God, they don't stop.
Oh, they love to comb your hair?
Oh, they
Oh,
mess
that
it
must feel
all
nice.
Yeah, it does.
You get a spa treatment.
I
See,
know.
my kid babysit, and she wasn't supposed to either. She ran out of situation until she had to.
Oh.
It's not easy having to take care of kids every day. But that's so cute if she don't say no. Oh,
Especially this day, and
Oh yeah, and then
when
she's got a bad, she's got 3 discs that are out in her back, and she's got a bad leg,
Yeah.
bad hip. She's in misery. You want me to put my leg up here, or would it be
No,
better?
I'm just thinking.
I think it's better
See, this
down
was
here.
a tiny strip. I almost liked it when it was cut this way. They were longer to wrap around the whole.
Well, then cut it the other way, do whatever you want to do.
Let me just see here.
I don't care. Whatever your heart desires. Everybody does it differently. Would you need for you to do you want my leg down?
Oh, it's
Are
fine.
you okay?
So who have we been getting wound care orders from? Primary?
no idea,
Okay.
because I've been wondering
It
that
didn't sound
myself.
like, it didn't sound like you, so.
Yeah. I mean, these were the orders that I put in when she was in rehab, so
Yeah,
maybe
I
they just
haven't got it.
continued
Oh,
with the
okay.
hydrofera blue.
Oh yeah, we don't do nothing.
You know, I don't.
They-
You know,
they
here was the other conversation I had with one of the nurses, the last nurse I spoke with.
Okay.
Was I said, you know how when people have like either an adult diaper or even a little baby diaper, they have that material that's absorbent, but it's covered with something that keeps the skin dry. So like the fluid goes to the gel, it becomes a gel.
Right, right.
So when I remember last time I spoke with one of Joanne's nurses, I said, isn't there something in wound care, because I couldn't think of anything, that would have better absorption yet stay dry against her skin? And she said, oh yes, I think I know exactly what we can do, and then I never heard from her again.
So it's something different than the hydrofera blue.
Well, the hydrofera blue, have you worked with it before?
Not much.
I think you're supposed to actually, although it's counterintuitive, you're supposed to wet it before you put it on,
They've never
and it
wet
absorbs
before.
better, but let's just not.
Yeah.
Okay.
Well,
I was
they've
gonna say,
never
I
wet
didn't see
it.
that on
They've
Yeah.
never wet it before.
Right. If I recall how it was shown to me by the company representative,
the. Okay.
that it becomes more absorptive, and
That makes sense.
it's
too.
counterintuitive.
Yeah, no, but yeah, there is, as you know.
That doesn't that make more sense?
Certain things that we use
I
that
have heard
Right.
it, so
are like
let's
that.
get it
Have
wet.
you?
But
I have.
I just want to see what records you guys have. Joanne, I want to check your most recent lab work, and I want to check what meds you're on.
Okay.
And then I think even while we're waiting for a fungal culture, I'm going to start you on the antifungal medication.
Okay.
All right. And you guys can help me figure out how to put that order in.
Yeah. Again, I can just take a verbal for that.
Okay.
And enter it.
But yeah, I just need to see what she's already on and what. When was the last blood test you had, Joanne?
Blood test a month ago.
Okay. Do you know if they checked liver functions?
I think they checked everything.
Okay. And Angela, do you have that or access to that info?
I can check to see if they faxed it to us.
Okay.
It's not something that we drew for you, correct?
Yeah.
We drew it for you, your blood work?
Jackie.
Okay.
Jackie drew it.
Last month, wasn't it?
Then it,
Last month.
then it probably, I'll look here, it might be fast.
A
Okay.
month ago. 2 months.
I know that it was last month.
Yeah.
I'm pretty sure.
I have a copy of it if you get at it. You know, I have a copy of the blood.
You guys do such a beautiful job. Way better than I could do, Joanne. Mine
As I'm
never,
fumbling to get this open.
mine never looks so nice and neat.
Okay.
Yeah.
Sorry
yeah.
about that.
It stays like that. Yeah. It stays like that.
Sorry about that.
Yeah. How would you know if you don't work with it all the time?
Okay.
I'm just gonna move this guy.
Yeah. Jessica,
Yeah.
I don't know if you can find it. You see my piles there? The second pile,
It's not.
yeah, can you lift that up? Lift that up for me. No, that you leave down.
Okay, it's
Just,
not.
yeah. Hey, the first thing.
All right.
How you like that, girl? The first thing, yeah, that's, I'm sure that's, yeah, that's easy. No, but I have to have
Hey, I
that.
always say, if you know how it's organized.
I know where my stuff is, my daughter never
I
can find
mean-
it, I know where everything is.
Yeah.
It's like my daughter too with her schoolwork, and she's like, I know where everything is. I'm like, okay, fine.
You like the big cake too, huh?
Well, it just seems so unorganized to me, but not to her, so.
All right, so Joanne, it looks like they did a cholesterol panel on your liver, but they did not do liver enzymes. So we're gonna need to see that before I can prescribe the antifungal medicine. This is Joanne in her native habitat, her apartment. And you wanted to say to your multitude of fans, Joanne, what?
Thank you for following me and thank you for having patience. And I also want to thank Dr. Sperling for coming out today. And I want to thank the nurse Angela and also my therapist Jessica. I appreciate very much and the work they've done.
You've got a good team here, don't you?
I got a wonderful team here. I got the best.
Okay.
So I'm getting better and I hope to improve. I'm about 70% and I hope to get better in the next couple months.
Great.
So thank you and keep following. Don't give up. Have a
Okay.
great day.
Thanks.